Hi everyone! So today we are going to be laying the groundwork for epidemiology. This is a basic introduction to cover definitions, examples of what exactly epidemiologists do, what they study, and more. In addition, we are also going to review examples of different health events in a population and also hear a story about the father of field epidemiology, who is Dr. John Snow. This video is designed to act as an introduction. So as you continue viewing these supplemental videos that are pertaining to different epidemiological trends in health and medicine. This can be pertaining to pneumonia, COVID-19, influenza, and more. You should be able to easily follow along as well as understand the terminology that is being used. Since you all are pursuing careers in health and medicine, learning about these concepts can help with future disease trends that you will likely see in your future occupations. So with that being said, let's go ahead and get started. So what is epidemiology exactly? Well, according to the CDC, it is the study of the distribution and determinants of health-related events in a specified population. In a roundabout way, this means that epidemiology is what is used in order to find the causes of different health outcomes and diseases in different populations and within communities. So for example, if there's a foodborne disease outbreak of norovirus due to a convention that is held at a local conference center, different epidemiological concepts will be used in order to figure out what was the root cause of this outbreak and what can we do to control it. So what exactly is it that epidemiologists study? Well, they can study a wide variety of public health problems and events. This includes, but is not always limited to, environmental exposures such as air pollutants or asthma triggers, infectious diseases such as influenza, pneumonia, and foodborne illnesses, injuries such as surges in different types of health event or increased homicides in a certain area, as well as non-infectious diseases, which could be a particular type of cancer, having a spike in cases, or maybe an increase in birth defects in a certain area, as well as natural disasters such as different hurricanes, or even terrorism such as, the World Trade Center in 2001 and anthrax. So what do epidemiologists do on a daily basis? Well, it can pertain to a variety of different tasks, but in general, they usually do surveillance of different public health trends. They also do field work and field investigation, as well as research of all different types. This can pertain to qualitative as well as quantitative data, evaluation of different policies, programs, and then they also work with policy development as well in order to implement and create new ideas and fix potential problems within the public health area. So let's take a look at two different really important terms regarding health events in a certain population. So the first one is defined as frequency, which means the number of health events compared with the size of the population. Now I'm going to show you all a software that is known as FluView. So as of right now, flu cases are relatively elevated, and FluView is updated every single week. So as we can see, we are now examining the positive influenza tests that have been reported to the CDC by U.S. clinical laboratories. This national summary is from October 2nd, 2022 to December 17th, 2022. As we look at this trend line, we can see percent positive as well as positive flu A cases. There's only a very, very minimal amount of B strain flu going around. As we can see in this graph, the largest peak is occurring in the 48th week of 2022. So as we can see, the x-axis represents the week that we are in. However, the y-axis represents the number of positive specimens, and again, this is on a weekly basis. So as we can see here, during the 48th week of 2022, we had approximately 47,000 weekly positive flu cases. So as we can see here, there are approximately 331.9 million people living throughout the United States this year. So for example, if you wanted to know the frequency of positive influenza tests that were reported to the CDC by different U.S. clinical laboratories for the 50th week of 2022 specifically, we could look at this chart and we could tell about 33 43,000 individuals had positive tests out of the entire population of 331.9 million individuals. And this is solely throughout the United States. So now that we know what frequency is, let's look at pattern. So pattern is defined as the occurrence of health-related events by time, place, and person. This occurrence can be very broad. It could be yearly, based on certain seasons, weekly, daily, anything of that nature. Now, when you are examining patterns regarding place, this typically involves geography. So there could be a location like a daycare or a school, as well as maybe a city versus a county, and then also person, which would be a demographic factor. So this could be age, sex, marital status, socioeconomic factors, and other exposures of that nature. Since we used influenza for frequency, let's use it as an example for pattern as well. A lot of us are likely familiar with the concept that flu season usually occurs throughout the fall and the winter. This is a seasonal pattern that we see, like I mentioned prior. We usually see flu activity peaking somewhere between December and February. So as I said, epidemiologists collect this information, and this is done to see exactly when these diseases will be the most prevalent. Let's talk about the father of field epidemiology, who is Dr. John Snow. He was an anesthesiologist, and what he sought to do was investigate different cholera outbreaks that were occurring throughout London. He wanted to figure out what the cause of the disease was, and he wanted to prevent it from happening again. In 1854 specifically, an epidemic of cholera was erupting in the Golden Square of London. His research began when he tried to figure out in which area individuals that were diagnosed with cholera lived and worked. What he did was he used the map on the right to draw little spots for each residence that had cholera. From this, he was able to see the geographic distribution of cases, and it's called a spot map. Dr. Snow was looking all over for a potential source of infection, and he actually thought that it was found in the water pumps. So when he was looking at the distribution of the different cases, he really hypothesized it was because of pump A. There were more case households clustered around it than around pump B or pump C. When Dr. Snow went around to a variety of different houses and he asked which residents use which pump, a lot of them said that they avoid pump B because it was unhygienic and pump C was too far away for most of them to use it. When given this information, he could conclude that the vast majority of individuals in the area used pump A. Dr. Snow then gathered further information to see exactly where these individuals who were diagnosed with cholera got their water from, and it was confirmed that the common denominator between all of these individuals was the use of pump A. After John Snow confirmed his findings and presented them to city officials, the pump was then removed, and as a result, the outbreak ended. So solely based on our previous discussions, I think it's pretty apparent as to why epidemiology is so important. But they've also created prevention programs for different diseases, and they've also researched different clinical investigations that have created new interventions for different diseases and have helped improve the well-being of our populations. And over time, we have seen epidemiology not only prevent mortality, but we've also seen drastic improvements regarding quality of life for a lot of different individuals. So what is the most recent updated data that we have regarding mortality rates in the United States? Well, that comes from 2020, where we did see the introduction of COVID-19. So as we can see, COVID-19 is now on the list, but typically this changes very minimally, and we do have slight variations from year to year, but not anything drastic. However, all professionals within the healthcare realm should look at this list of causes of death and wonder, what can we do to lower these numbers? So now let's look at different methods for preventing disease, known as primary prevention, secondary prevention, as well as tertiary prevention. Starting off with primary prevention, this is a type of method that stops the disease from developing. So a perfect example of a primary prevention method would be vaccinations. Secondary prevention methods detect the disease at extremely early stages, and this is designed specifically to reduce the severity of it. So for example, cancer screenings. As we know, if certain cancers are caught early, then they will be reduced in severity in most cases. Finally, the last method of preventing disease is known as tertiary, which reduces the effects of it after it has happened. So as an example, completing rehabilitation after a stroke occurs would be an example of a tertiary prevention method. So now let's discuss hand hygiene epidemiology. Dr. Semmelweis was a physician who was Hungarian, and he practiced inside a maternity clinic at a general hospital in Vienna. At the time, he noticed an increase in women dying from childbed fever, and he wanted to conduct autopsies to figure out exactly what was going on that was causing this issue. So what he ended up doing was he studied 2 different maternity wards that were in the same hospital. However, one of them was staffed by all male doctors and medical students, while the other was staffed by female midwives. When he started analyzing the epidemiological data that he collected in both units, he noticed that women in the clinic who were staffed by doctors and medical students died at a rate that was nearly 5 times higher than women in the midwife clinic. So what was going on here? Well, he sought to find an answer. So at first, he started analyzing the position that women gave birth, because in the midwife's clinic, women gave birth on their sides, but in the doctor's clinic, they gave birth on their backs. But it was proven that there was no effect on that particular instance. However, it was soon determined that this was not the cause of the increase in mortalities. After some more thought, Dr. Semmelweis realized that the physicians that were in the first clinic actually conducted autopsies, while the midwives did not. So how did these 2 things correlate? Well, it was hypothesized that during the autopsies, pieces of the corpse would get onto the student's hands or the medical doctor's hands from who they were dissecting. However, when they started delivering the babies, these particles would then come into contact directly with the women who were giving birth. At this time, there were virtually no hand hygiene practices that were occurring, and this also explains why the midwives had such low infection rates in comparison to the first clinic with the medical doctors. The midwives did not perform autopsies. With this theory being hypothesized by Dr. Semmelweis, he decided to order his medical staff to start cleaning not only their hands, but also their instruments with soap and a chlorine solution. After the implementation of this new rule, rates of childbed fever fell dramatically. So now that we've talked about hand hygiene and disease prevention, let's talk about 2 fundamental concepts, incidence and prevalence. While incidence shows the frequency of new events occurring, prevalence demonstrates the frequency of existing events occurring. In this particular slide, the 2 key words are new versus existing. That is the only deviation between the 2 terms. Now, let's talk about bias and the potential for it occurring in epidemiological research. So basically, bias only happens when there is some sort of error in the design of a study. Now, bias is arguably almost inevitable. However, there are some preventative measures that can be taken in order to reduce the amount of bias in a study. Now, when bias is present, it can lead to an inaccurate estimate of the effect that exposures can have on the risk of developing disease, which will in turn make your study significantly less accurate. Now, which types of biases can occur for these particular studies? Well, starting off, we have a selection bias. So this basically means that the participants that are involved in the study would have different probabilities of being included based on certain characteristics of the study. This is an example of a selection bias for a particular study. Now, as we can see, the bold arrow indicates that an unproportionate amount of the population are involved with the diseased exposed quadrant. So this means that the study would be biased in that particular direction. Now, what is misclassification bias? Well, this occurs when individuals who are involved in the study are incorrectly placed in different exposure or outcome categories. This leads to them being misclassified and then misanalyzed. So what makes bias happen in these particular investigations? Well, it can occur for a variety of different reasons. It can be during the data collection or even after the fact when researchers are analyzing it. However, there's also a very important topic called confounding. Confounding can also cause bias, which we will talk about momentarily. So what is it? What is confounding? Well, this happens when there's a non-causal association in between an exposure and an outcome, and this happens as a result of the influence of an unknown third variable, which you can discover. However, the confounding variable must be related to the risk factor and the outcome. Here is a perfect example of what we are referring to. As we can see, there's an exposure. It leads to an outcome, but unbeknownst to us, there is a confounder involved. To prevent this from occurring, there are methods that can be used to adjust for potential confounders. However, that will not be discussed in today's video. That is all for the Introduction to Epidemiology video. I look forward to diving into specific diseases and investigating epidemiological trends, as well as how they are transmitted and their incubation periods in the future.